Okay, so part three, discussion about some alternatives. So, Dr. Hang, what are some alternatives to extraction and traction, and how can parents learn about them?
Well, the first thing is if you're going to, we ought to try to prevent the malocclusion in the first place. We need to back this whole thing up to really even talk to mothers before they have children and get into prenatal counseling. Then we need to take the child immediately after birth and encourage breastfeeding for a long period of time, and then weaning to solid foods, not weaning to baby foods. The point is you want to have the child eating vigorously using the facial muscles. There's studies that are out there that go way back indicating that that's why the face is going to grow forward better. It's not a genetically determined thing to have a malocclusion, even though most of us were taught that. In my opinion, the evidence is strongly the other way, that it's an environmentally determined thing. So we ought to try to be working with the young children, having myofunctional therapy be a huge part of what goes on. Uh, Most people don't even know who myofunctional therapists are. But if we had myofunctional therapists treating very young children and helping them keep their teeth together, their tongue to the their lips together, and learn to breathe through their nose, then we wouldn't be having malocclusions in the first place. Now, if we don't get that done, then what's the next alternative? Well, the alternative is to do orthotropic treatment, which takes the 3 to 10-year-old child, moves the upper teeth and upper jaw forward, and then moves the lower jaw forward to develop the face. And we've shown in the refereed literature how we can increase the airway in so doing. Let's say we miss that one as well, and now you've got a 12-year-old child with crooked teeth. What's the alternative to taking out teeth? Well, it's a simple one, not taking out teeth. There are ways to create space to line the teeth up and not compromise the tongue space. I've been doing it for 30 years. So, as one very famous dentist that I love says, if it's been done, it's probably possible. And it has been done. So, there are lots of alternatives, but the best thing is for sure not to have the teeth taken out in the first place.
Okay, thank you, Dr. Hang.